Hey guys, hello everybody, welcome back to my channel. Welcome. If this is your first time, you are so welcome. Thank you for believing in me, thank you for clicking. If you're a returning subscriber, thank you so much for staying. It means a lot to me. It means a lot to this newfound passion I have for vlogging. Thank you guys so much for the comments, the likes, for sharing, for telling your friends, about my channel. A whole lot of people reached out to me, via inbox, especially via Facebook. A whole lot of people have been reaching out to me, asking me questions, about the care visa, how they can qualify. You mustn't be a nurse, you mustn't be a doctor to be a healthcare assistant to qualify for this care visa. So I'm going to be talking about healthcare assistant and healthcare assistant roles, the trainings you need to get, and the mandatory certifications you're supposed to have, and where you can get the certifications for free. They are recognized in the UK. You can get them absolutely free. So thank you guys. Thank you. Guess who is at the background? My husband is somewhere giving me moral support. You see, I am so excited. When a husband supports what you're doing, it gives you a lot of morale to do more. Thank you, babe. So let's get straight to the point. What's the care visa about? This care visa is for professionals, health professionals, for doctors, for nurses, but healthcare assistants have been added into the shortage skilled, workers visa. So how can you qualify for healthcare assistant role? You mustn't be a nurse or a doctor. But one thing I assure you, you must have the mandatory trainings to be a healthcare assistant. Okay, let me just take you guys a little through who a healthcare assistant is. A healthcare assistant is health professional or a health person who gives care to people in the hospital, care homes, in people's homes, in gives people care, domiciliary care. It could be domiciliary care, it could be support worker role, it could even be, a living carer, people who live in people's houses. Okay, let me talk a little about the difference between the styles. A support worker is somebody who gives support to people. It could be shopping support, it could be, going to events with somebody who is not strong enough to do that by themselves. It could be following people to the park, it could be support, giving support, emotional support, physical support. Then who is a domiciliary care worker? A domiciliary care worker is someone who works, who gives this care, goes to people's homes to give them care. You're available in people's houses to wake them up, help them brush, help them do personal care, help them do domestic chores, help them with one or two errands, cook for them, prepare their meals, go shopping for them. Do you get? Attend events with them. The domiciliary care workers mainly do these jobs in the client's houses. Then for people like me who are healthcare assistants, we go to our offices, hospitals, care homes, to give care to people, who are vulnerable, elderly people, children. It could be a mental health home, people who are going through a process, and then they need support. So now, having made you guys understand the differences and the jobs, now let me take you guys a little on the responsibilities of healthcare assistant. First, you give people personal care. You help them bathe, you help bathe them, you help them with their cleaning, you help them with incontinence, you help them with toileting. Secondly, you help them with emotional support, you chat with them, you're there for them. Thirdly, you're there to groom them, cut their nails, help them comb their hair, style their hair. Do you get? Then you can also help them with some other stuff that is required of us. It could even be manual handling. But all these other ones require professionalism, require a classroom-based training for you to be able to do that. It could be catheter care. So you see, these things are things that Most of the time we do every day, even in an informal setting. You guys wouldn't believe, I attended an interview and there's this particular role, they asked me about. They were like, even if it's an informal experience, even if I've experienced it out of the hospital, and it helped. I answered that question based on my informal experience, and they were so proud. And funny enough, they offered me the job. So you see, if you are not after getting these trainings, please, I'm going to encourage you guys to volunteer. Go to hospitals and volunteer. Volunteer to look after people. Volunteer to, you mustn't get paid for everything. You mustn't get paid for everything, really. You mustn't get paid for everything. You need these experiences. You need these experiences to be able to get these jobs. So let's go straight into the point, the trainings that you need. One of the trainings, there are a whole lot of mandatory trainings, but I'll just mention a few. And then at the end of this video, I'll refer you guys to the site where you can actually get the certifications for free. One of the trainings you have to get is first aid. You have to be a certified first aider to be able to work in the care home. Another training is infection control, fire safety, health and safety, information management, safeguarding adults, infection control. There are a lot of mandatory trainings that is expected of healthcare assistants, to get. So where can we get these trainings? You can go to Florence Academy. Go to Google and type Florence Academy. Florence Academy gives us these trainings for free. They do not charge, and these certificates are recognized everywhere in United Kingdom. I started doing my Florence training back in November. Immediately I started nursing the idea to relocate to the United Kingdom. I started doing Florence care training. And you will believe, today I am one of Florence carers in United Kingdom. I have my ID. So I'm encouraging you guys, do these trainings. Spend your data on improving yourself. Spend your data getting trainings. Do you know, sometimes I wake up after my prayers in the morning, the first thing I do is to go to Florence Academy, read, do the assessment, get one certifications before I come out of my room in the morning. I repeat the same process before I go to bed. I go there, learn, do the assessment, get the certificate, download it before I go to bed. I have like 14 certifications from Florence. 14 certifications. I have used those certifications to apply for jobs, and I got jobs. So you see, another thing you need is experience. That is why I told you guys to go and be volunteering. Go to hospitals and volunteer to care for people who have been admitted. Give palliative care to people, support people, in informal settings, support people, give them this care. It's going to go a long way. It mustn't be a paid job. You mustn't be a paid job. It must be something. They need experience, and they go and they need referencing for you to be able to work in the United Kingdom. Even though some people, take you through trainings again for you to be able to work for them. Like I have another job I just got. I have started training all over on dementia. I have started training all over to be able to fit it into the new role I am applied, like I just got, I was offered. So you see, all these things are necessary. Florence Academy gives you all the certifications you need for free. They are free and they are recognized everywhere in the United Kingdom. So you see, thank you for always coming. Thank you for always coming. I love you guys, and please, whatever questions you have, put them in the comment section. I will respond to each and every one of your questions. Direct your questions to me, put them in the comment section. Please like this video, share it with your friends, share it with your neighbors, tag people to be able to see these videos. It is for your own good. Nobody is paying me to do these videos. It's just, because I have researched so much and I have a whole lot of stuff